Dr. Lucky, you're a fertility expert. I want to do some rapid fire true or false. Birth control ruins your fertility long term.
False. Birth control, most forms of birth control work by preventing you from ovulating, and that's the goal, to prevent an unplanned pregnancy. And many forms, when you stop, are immediately reversible.
It can take up to a year to get pregnant even when everything is normal.
True. I always say that human reproduction is very inefficient. Even in your 20s, when everything is in working order, every month when you ovulate one egg, there's about a 20% chance of getting pregnant. And after 1 year of trying, 85% of couples will be pregnant.
Painful periods are normal and everybody should just deal with it.
False. We all too often normalize women's pain, and a lot of times people are told to suck it up. But we know that endometriosis is very commonly underdiagnosed. It can take an average of 8 to 10 years to get a diagnosis. If you have pain that is debilitating or preventing you from working or going to school, that's never normal.
If you're less stressed, it'll be easier to get pregnant.
False. This is a big one. A lot of people feel stressed about being stressed. The truth is, of course, profound physical stress, like caloric deprivation or overworking out, could interrupt ovulation and therefore make it a little bit harder to get pregnant. But in general, day-to-day stress is not a cause of infertility.
You can't get pregnant once you hit perimenopause.
False. By saying perimenopause, that means you still have ovarian function, you're still able to ovulate, even if it's sporadic. And if you're ovulating, you're in the game.
Men play a big role in whether a couple can get pregnant or not.
True. They are 50% of the equation. 50% of infertility has a male factor. And it's often overlooked, and it's actually a really cheap and easy test to do. And it's not just about getting someone pregnant. It's also about the health of the pregnancy and the health of the future child. So we need to focus on both male and female health and fertility.
Egg freezing is a guaranteed way to get pregnant.
False. I love egg freezing, but egg freezing is never a guarantee because human reproduction isn't a guarantee. Not every egg that you ovulate or freeze is guaranteed to lead to a healthy pregnancy. So it's important to talk about numbers with your doctor and think of it instead of a backup plan or a guarantee as more of a head start if and should you ever need IVF at an older age.